I think everyone knows that healthcare in the United States is pretty expensive. What you may not know is if you look at the cost of healthcare per capita in the United States and compare it to all of our similar countries, countries that are relatively wealthy and educated, the cost of healthcare in the United States is by far the highest. But when you look at preventive health and being healthy, and a big part of that is having access to primary care providers who can help you in this journey so you don't end up in the hospital. The number of primary care providers per capita is just the opposite of the cost. So if you look, the cost, we're way high. The number of primary care doctors per capita, we're the lowest of any of them. And there are lots of reasons that that has happened. Part of it is that the emphasis on very highly specialized care in the United States, which I do think is terrific. But part of it is that we just haven't had an emphasis on health. And I personally have grown to believe that if there's one thing that can save us from the cost of healthcare in the United States, it's us being healthier and not having to go to the emergency room or not having to go to the hospital. Or if we have to, we're a lot healthier when we get there. So it's not as complicated. But there's another interesting aspect of life in the United States. Epidemiologists calculate what they call the healthy average life expectancy. So that is, in any country, how long do people live a healthy life? So I'm not talking about if you're totally debilitated, but that's total life expectancy. But how about if you're healthy and you can do what you want to do, you're mentally intact and you're physically intact? When that is looked at, the United States, this is going to shock you, shocked me, ranks 60th in the world, 60 in the world in healthy life expectancy. So there are 59 countries where your chance of living longer and healthier is better than in the United States. And these same models show that if we don't turn things around, by the year 2050, we could be 120th in the world. And it's because of chronic disease, really. It's because of this huge wave of obesity and diabetes and all the problems that diabetes carries with it. It's also due to the problems that have been rampant in the United States around opiate misuse and alcohol misuse. So there's some things that we could do that are not easily done. And I'm hoping that people will read this book, The Great Healthcare Disruption, and think, well, I need to take better care of myself.